Have you been a victim of sexual trauma and you just don't know how to get past it? Do you know someone who has been a victim of sexual trauma and they're just not willing to talk about it? If so, this podcast is for you and it's also for them. So make sure you share this podcast with them. And this is your boy, Coach Wells, and this show is called The Podcast. Therapy helps everyone. All right. So we have our amazing guest with us. This is Conswello Davis. She's actually a therapist and she works with me here at DRT Behavioral Services. And the best thing about her is that not only she's a therapist, but she has a background in business. She's also a yogi. She's specialized in EMDR, which we will get into later. But also, she's really just a great person, and she has so much information when it comes to not only trauma, but also sexual trauma. And one thing about her that's amazing is that she's studying to be a sex therapist. So for all you guys that have been a victim of some type of sexual assault, trauma, harassment, whatever the cases may be, this is the perfect episode for you. All right. So I know I just gave a quick little intro. Conswello, feel free to tell the people a little bit about you.
Okay, so I'm Conswello Davis. I'm originally from Nashville, Tennessee. I relocated here to South Florida. Presently, as Coach Wells stated, I do work with him here at DRT Behavioral Services. I focus on a great deal, mostly trauma and sexuality, sexual orientation. Presently in a doctoral student working on my PhD in clinical sexology, and will soon be licensed as a sex therapist. So I'm looking forward to these new endeavors.
Dope. Yo, I appreciate it, man. I really think that we're gonna give the people what they want. And we're gonna give you guys a lot of resources at the end. So make sure you stay tuned until the end. We have book recommendations, but also we'll further explain what EMDR is and why it's so important for not only sexual traumas, but also just traumas in general. So you want to stay tuned for those recommendations. So with that being said, let's just start off at the beginning.
Okay.
Like, do you mind telling us just what is trauma?
Okay, so trauma is really your body, your mind, perception, experience of a stressful experience. Trauma is a place where your body may go, your mind may go, where you may feel and think, oh, this is not real. There's shock involved. And then also exhaustion. You're exhausted by the experience. So basically, we can sum it up as a very stressful psychological experience. However, you will feel it all over in your body. Heightened stress.
Yeah. And I think a lot of people, when they hear trauma, they automatically think about war veterans, right? Like this is just so classical, right? But me and you both know that trauma comes in different forms, right? So we have not only the primary traumas, but we have things like secondary trauma, vicarious trauma, compassion fatigue, right? Caregiver fatigue, which is along those lines. But I think a lot of people think that, oh, you have to have like a near-death experience to be traumatized.
Okay. I like to explain trauma. There's 3 different types that okay. I definitely work with and see, right? So we have acute trauma, right? People can go out, you can have a car accident and suffer from acute trauma, right? Then we have the chronic trauma, right? That could be someone that is involved in a domestic violence relationship, because then you're in the home with an abusive perpetrator or abusive person. And then we have what we call complex trauma. Right? And the complex trauma is something that you relive and it's happening over and over again. And that comes from like some urban experiences. I'll give that example where people are living in a neighborhood where there's constant drive-bys, drugs, gangs, and things of that nature. So, people do develop trauma from living in certain neighborhoods.
Yeah. You know what's funny about that? I was working with a young guy, probably like 16, 17. And he mentioned that he was nearby where a shooting happened in his neighborhood. And he told me that every time he would go near that area, he would just hear gunshots, right? Like, and these gunshots, they weren't real, right? They were just hallucinations that he was hearing. And me and you, we both know, we were talking about this off camera, like the body really does holds on to a lot of those traumas, right? Your body doesn't really forget those. And I haven't really done too much studying on this part, but I heard that even women, when they give birth, there's like a biological element of passing down that trauma to the newborn baby. And like these things are just so important for people to know, because if you don't address it, you truly do pass it down, right?
Yeah.
So like it's so key, not only for everyone, but especially our people, to definitely get into the therapy offices.
Well, I'm glad you touch on that, because that's where the multi-generational, intergenerational trauma happens, right? And we don't understand because we don't piece it together in that way. But there are now studies, and then I hear women all the time, I suffer from anxiety and depression. Now my daughter suffers from anxiety and depression, because you're still holding on to that trauma. Exactly. And you might not have experienced it yourself, but you just made a great point. It's passed down.
Yeah. So it's almost like a genetic thing.
It is DNA. I say all the time, we have to go within and bring it out to the world, because our healing takes place inside the body, and it starts here with the mind first, though.
Gotcha. That's deep. All right, cool. So like let's get a little bit into like the sexual traumas, right? Like I know this is your field, and even me as a therapist, like all therapists, all licensed therapists, that they're licensed, like they can treat everyone just like a doctor can treat everyone, but just like you go to, let's say, a chiropractor for back problems, you want to go to specific therapists for your specific needs. And I know this is an area that you specialize in. So just kind of want to start from just a wide angle. What is sexual trauma? Like, because I know I gave an intro, but kind of like from your words, like, what is sexual trauma?
Sexual trauma, in my words, would be trauma that you experience via the act of sex, or being violated in the act of sex, right?
Yeah.
Because when we look at even, we can go into molestation, we can go into rape, we can go into incest, like that. That is a violation of your body, right? If you're not consenting, or you're not old enough to consent.
Exactly. And like this part, I'm not trying to shout out or put my guys on blast, but like even like harassment done in the workplace to a degree can be traumatizing, right? Yes. Like if you're a lady and you're working, let's say, in a Fortune 500 company where it's mostly dominated by males, and you're the only female in that space, it can be tough. If you want to, let's say, dress professional, and that includes a skirt, a blouse, or whatever the case may be, like the fact that you have to be mindful of how you walk into those spaces, because there may be some previous like harassment cases, it's tough. Like, and women shouldn't have to go through that. And then we didn't even talk about in the military how there are some instances where there's some sexual harassment going on with the women and things like that. So not only does those traumas happen like physically, but these can be just the verbal things that can be happening. So like I wanted to point that out just for a quick second, but I want to also talk a little bit about what are just, and you don't have to give names or cases, obviously, all that stuff is confidential, but what are some things that you've heard when it's come to like just sexual trauma, like how people have
been dealing with coping with it? I've had women up to 70 years old, and as young as 16. What's really profound for me is that the older women that have carried this the majority of their lives.
Wow. Is it like their first time seeing you? Sometimes it's like the first time they ever
they want to open up and talk about it.
Gotcha.
They haven't trusted even if they've been in therapy before. Haven't trusted to go there with the therapist.
Is that a lot for you?
Yes.
Like, I can imagine like they're giving you something that's so is the word precious okay to say?
Yeah.
Like they're giving you something that's so precious, and they're trusting you with this information, and I think that could be a lot for just therapists in general, right?
Well, you remember what we were talking before, where I said, okay, I had to make a conscious decision about being in this space and what I was going to be doing and what I was called to do is to heal, and that trauma that's a part of the healing. You can't get to the real you if you're setting in that trauma.
Gotcha.
Right.
Okay.
So, but to go back on some of the clients and patients I've had, the date rape in college. I've had a student where she had a boyfriend, right, in the home, and they were just all hanging out and fell asleep on the couch. Boyfriend goes up, upstairs because he can't wake her up, and the friends in the room, in the spare bedroom, and then all of a sudden he's on top of her, and so all of and then you're carrying that,
Gotcha.
you know what I mean, because you don't want to separate your relationship, because what if he don't believe me? What if
let me touch on that because I've had like a few clients here and there that have been in that space, and I think what's tough for them is either one, like, and acknowledging what has happened, or being able to tell people what has happened, right? Because they feel that people don't believe them when they say this. Right. So like, how does someone develop that courage to really like come and tell someone like, hey, this has happened? And let's just say like with the therapist, like how does someone develop that courage to like come to a therapist and say, hey, like I've been sexually molested or raped or traumatized? Like how do they build that courage?
I think it comes from the rapport, and them being able to sense and understand that you are there to really help them. It's not just a formality, so the rapport and trust is huge, right?
And I like that, obviously you're a woman doing this work. I think, and we're going to touch on this, like there are also men that have been traumatized, and I've come to meet with a few of them, and we're going to get to that part. But when it comes to women, like I like to think that they probably would feel more comfortable speaking to a woman about some of the things that they've gone through versus necessarily like a man, because I can only imagine, like, because I haven't been in that space, but I can only imagine how tough it is to speak to someone that may resemble, your perpetrator, right? Like that can be tough, that can be triggering. So when you say like meeting someone that is like trusting, building that rapport, creating that safe space for them to really like be themselves and let their guards down, I think it's just so important, man. I love that you do that. But as I mentioned, there is a myth that men cannot be sexually abused, right? There's a myth, and I see you shaking your head. Talk on it. I'm not even gonna give you, just talk on it.
I've had plenty of men, and that is the thing that I think holds them back from even acknowledging it for themselves, right? Because it was a woman that did it. And I'm supposed to be a man like that. This didn't happen to me. Because I was becoming into my age of being a man, my rite of passage. But really, that individual was older, mature, and knew exactly what they were doing, manipulating a situation.
So, like, if for whether it's those men or those women, what has been some of the aftermath of their sexual traumas? Like, how do they? I'll just leave it at that. What is some of the aftermath of those sexual traumas?
Well, I mean, there's depression, there's sadness. I've had clients that, because of everything that happened and holding it in, don't have support and feel they can't communicate it. Suicidal ideation, there's so many different feelings that individuals can feel, disappointment, sadness, guilt, shame.
Ooh, let's touch on that. Because like there's so much guilt and shame that is attached to it when they had nothing
to do with
nothing to do with it. And like because you even hear this in court cases, unfortunately. The prosecutors or the defendants, whatever it is, they'll say, like she shouldn't have been wearing this, or she shouldn't have been late walking by herself and things like that. And that's just gaslights, right?
Yes.
The person that's been a victim of this, right? So it's like
victim blaming,
right?
Re-traumatizing.
Exactly. And for those people who don't know, like gaslighting is basically when someone makes you question your own experience.
Yes.
So it's like, how can someone tell you not only like what you've experienced, like a fact, but also like what you're feeling? Like I can't tell someone like you're not sad, you're not depressed, you don't feel shame. Like I can't do that because I'm not feeling what you're feeling.
Exactly.
So I can only imagine how that just compounds on them, like kind of holding that trauma in and not saying anything.
And that's the reason why we don't have a lot of people that report right now.
Exactly.
Right.
Exactly.
And it's a societal ill. I say it's a societal ill because it's on our college campuses. It's just in intimate partner violence, domestic violence. It is something that now permeates our society that we could truly, I think and feel, eliminate.
Yeah.
And I want to say to everyone that is a victim or a survivor, of course, it is not your fault, and we believe you.
Exactly, man. That's so important, man.
You speaking on the legal system. I was an advocate for sexual assault victims, survivors, and that was one of the major issues we had with police.
Really?
And how they interview a victim.
Yeah.
Yeah.
Wow. Like that's hard. That's hard to believe. Like, and I only came across that from I want to say just watching like Law and Order, just like regular like TV shows where like this is actually a thing that happens. You know, like someone can actually make you question whether or not it was your fault or not. Like you can't make someone like, you know what I'm saying,
do those things.
Exactly.
They have to take responsibility. That goes to the other point. You know, me being in clinical sexology, I will be working with the perpetrators.
Oh,
so
wow.
Yeah. That's they consider us expert witnesses. You know, experts in the field. So that could be something that, you know, forensics I could go into. And I'm interested, you know, because once again, I believe I'm a healer. I am that.
Gotcha.
So it comes from both sides.
Okay.
You know?
Yo, is that tough for you working with the perpetrators?
I haven't worked with one just yet, right? Okay. Besides of internally, you know, but not like from a legal standpoint.
Okay.
So I've come to the terms with it that, you know, people need healing.
Exactly.
That's where it's at.
Definitely. You know, I saw a post on Instagram literally last night, and I was like, man, it's great that I saw this for today's podcast. So it was a lady holding a sign that says, "How come every woman knows another woman that has been a victim of sexual assault, right? Whether it's rape, molestation, so on and so forth, but not every man knows a man that has, you know, raped or sexually harassed, so on and so forth." And I thought that was just so funny to hear. So like I say that to preface my comments with this: how can us as men help women who have been sexually traumatized feel more safe in our presence?
Oh, that's a great question. I think being supportive, you know, being supportive, and if that person is vulnerable enough to express that to you, you know, be there and be supportive in what they need to do, want to do, and to facilitate their healing and empower them and encourage them. You know, the victim blaming doesn't help. You know, what did you have on, or why would you do that? You know, that's only really just putting salt on the wounds. So it's better. That's so healing. And I'll go back to, I think we were talking earlier, and I'm a big proponent of support. I've seen so many people that their healing can be facilitated by just having someone there to listen, to hug them and say they're going to be okay.
Gotcha. Good points. And like, even when, let's say, so I'm just making up a scenario. Let's say I was going to start dating someone, and let's say they've been sexually traumatized, right? And we've been dating for, let's say, 4 or 5 months. Like, how do I sexually engage them when they have this trauma? Because you know, as we mentioned, like, not to use a big word, but the amygdala, is a part of the brain that censors fear, right? And if you've been traumatized, it can affect how you perceive a cautious or a dangerous situation. Like so in other words, it makes us hyper aroused or hyper vigilant, right? So how can a guy who's been dating someone for 4 months sexually engage his girlfriend or their boyfriend in a way that they can, you know, feel comfortable?
Okay. So, and you're saying that person has disclosed to you.
Yeah, let's say they've disclosed.
Okay, and confided in you. So then that's where I think it's you asking them, what do they feel comfortable with? What do they not feel comfortable with? It should we just, take it really slow right now? Do you know triggers, because sometimes people don't know that's a trigger until they're involved, engaged in the act. So you might have to be as cognizant and present with that person so that if you notice something, somebody may move a little bit, don't touch me that way.
Gotcha.
That's what you can say. You can pull back and say, okay. I saw that. I don't want to. If that's engaging you in a way, I don't want to do that.
Yeah.
So, please express to me how you feel.
Gotcha. Nah, man, that's so dope, man. Like, and I hope men, women, whoever, like they're listening and they take note of that. Definitely be patient and communicate, right? And I think sometimes like talking about sex can be like so taboo that couples really don't do it. They just kind of like, they just kind of move in the ways they think they should be moving, right?
Yes.
And they don't really take the time to discuss, like, hey, like, what do you feel comfortable with? What positions or, what forms? So it may be petting, kissing, or foreplay, like, kind of like to warm up to that point, right? They just kind of like, okay, like, we're supposed to have sex, so this is how it's supposed to go.
Right. And I'm going to take it further. Like, explore each other's bodies.
Okay, yeah.
What's wrong with that? You know what I mean?
Yeah.
You're engaging in something that you're transferring great energy with one another, being intimate, right? What's wrong with exploring different points on the body and saying, hey, I like that. I don't know,
I actually sent the guy, so I had a guy that was dealing with ED. And I sent him something, and I forgot the name of it, but it's actually an exercise where first you practice touching the person's body, right?
Yeah, sensei focus.
That's what it is. That's what it is. Sensei focus. And what you do first is you lay, I believe you lay totally naked.
Yeah.
And you touch every part that's not a genital or private part. So you start off by touching like their shoulders, their arms, their legs. Right, and that person that's being touched, I think they're supposed to communicate
the same way, but no, it's stages.
Okay,
right?
Okay, yeah,
stages. And we take them through weeks. If it's couples that are really engaged, we take them through like 6 weeks of this, right?
Gotcha, yeah.
But whatever your partner does, you mirror in a way if you can, and then there's no sex involved.
Exactly,
no
exactly.
Sex involved.
Okay, and the goal is just to get them, as you mentioned, just more comfortable with their bodies, to where they can hopefully finally like have sex like at the end. It's not part of the exercise per se.
Not part of the exercise.
Okay.
It's like really getting in touch using your senses. You know what I mean? With your body and exploring each other's body so that what this person likes. What the person doesn't like. Don't touch me that way.
Move. It's like, oh, what was that? You know what I mean? Okay. Okay. Man, gems. You're just dropping gems. I love it. All right. So now let's jump really into like the healing piece. So again, I like to start off from like a bird's eye view.
Okay.
So how do you see healing? What is healing to you?
For me, healing is all-encompassing of the mind, the body, and the spirit or your soul, right? So it's going to utilize your 5 senses. It's feeling. I have a saying, healing is feeling is healing.
Okay.
That's all it is. You know what I mean? Really being in touch and present with self.
Gotcha. Okay. So, I love that you focus all 5 of those senses and, the sense of self and things like that is so important. And, as we know, like people that have been traumatized, they can feel numb, right? They can feel numb. And I think there may even be some people who struggle with when they're being sexual with their partner, like they don't really feel anything. They kind of feel numb. Guys may not be able to get erections, or ladies may not be able to be turned on, or orgasm, things like that, right?
Stimulated,
exactly. So it's so important. Going back to the sensei touching, that they kind of like get more familiar with their body, right? And I like to think that yoga, right, is something that can really help with that. So kind of tell us how you use yoga to help with the healing of sexual traumas?
Oh yes. Okay. So yoga for I do comedic yoga, and we focus on our shoot, which is the breath. Right. So in your breath, once again, it's a way of you centering yourself, grounding yourself, right? And when you're present and utilizing your breath, then you're going to feel the sensations in the body. You'll get more in tune with being comfortable with feeling the sensations in your body.
Gotcha. So if you don't mind, like what's like how does someone naturally, or how does someone breathe during yoga? Like, do they like breathe in for like 4 seconds, 5 seconds, like, hold it? Like, what is it that you tell them to breathe properly?
In comedic yoga, we do what we call our rule of 4 breathing. Okay, so we'll inhale on a count of 4. So as you're breathing, inhaling, you're counting to 4, and you're feeling your breath, right? And then you hold it for 4 seconds, and then you release in 4 seconds. And then you just pause. And we tend to do it throughout all of our different postures, you know, at certain points in time. And it just becomes a very natural thing and meditative. And we call it meditation in motion.
Gotcha.
Okay. But you're being present.
Yeah.
You know, in your body, feeling everything, and in that moment, you're just in tune with self.
Gotcha. Okay. So if someone is watching or listening and, you know, they've been sexually traumatized, like, how can they expect that journey of healing to go? Like, because I tell people that it's like, I don't want them to focus on a destination, right? We know that's a journey, right? It's lifelong. Like, what can someone expect going through this work? You know, can they expect it to be tough, hard, ups and downs, confusing? Like,
of course, it's work. You know what I mean? And work is, when we're doing it on ourselves, though, is very rewarding. We're going to see the rewards. We'll see the changes, right? So like in working with EMDR, right? We can go there with a patient and a client. First, we acknowledge what's happening, and we can go back to that moment in the processing of it in EMDR. Go to the moment, and we can look at it, and we can view it, and we can step outside of ourselves and see what's happening like it's a movie. So then we could come back in the present, right? And then we're able to say, okay, I saw that, and now I see what happened, and it wasn't my fault. Or I saw that I was very anxious and upset. So now I'm feeling that in my body right now. And then we can go from there and say, okay, let's go back to the memory. Let's go back and see how you feel. And take the positive feeling of this is not as sad as as if I was feeling before. Or I can view this now without crying. I'm stronger, and now I understand.
Gotcha.
You know, so it's a processing of it.
I was gonna say that it sounds like you helping them to reprocess what it was that happened, right?
Yes.
Because obviously we can't change the facts of what happened, but we change like how we process it, how we perceive it.
Right. So then it changes how we feel.
Okay.
You see how that?
I'm learning that, and I'm a therapist. I'm learning.
No. That's what I was saying.
Yeah.
This is great. You know, because then others will understand that everything starts here. You know, our eyes, perception, a brain gives us a thought, an emotion, and it's wired to our body. So then we have a feeling behind it.
Yeah. Okay. And just for the people listening, EMDR. Can you explain what it is and what the letters mean, and maybe the general framework of it?
Sure. Okay. So E is for eye, M is for movement, D is for desensitization, and then the R is reprocessing. So it's a very long term. So, but basically it's a way, I look at it as a way of facilitating healing for people in a way that it is not going to be like this process of I have to revisit it every time and talk about it and talk about it and talk about it, right? Now I'm in it. I am a movie.
Yeah.
You know what I mean? I'm set, and I can now change this narrative in a way that makes it comfortable for me. That's what EMDR to me is.
Gotcha.
It's a tool a resource. And we call it exposure therapy because we're actually doing it with the client, and we're not just sitting and talk there.
Gotcha.
Yeah.
Okay. And I'm glad you mentioned that, because I feel like, again, as you're speaking, I'm learning things that I can take away, and I think the audience will be able to do that as well. You hit on exposure therapy, and for people who don't know what exposure therapy is, you've probably seen it in movies where you see someone that's afraid of a spider. So what a therapist would do is show them a picture of a spider first, right? And then some anxiety may come on, and then it may go away. And then the next thing they may do is, let's say, show them a video of a spider. So now that spider is actually moving, and they see it, and they feel maybe a little bit more anxious, right? And then you kind of just keep going, and you just ramp it up to the point where maybe they go to a zoo and they see a spider, or maybe they're in front of a spider inside a cage, or maybe even outside of the cage, and they get more and more used to that stimula, to where now their reaction isn't as strong. Right? It's not as strong. And what I do sometimes is I have people do a hierarchy of all their traumas. And I think maybe even when you talked about complex trauma, this is probably a good place for me to continue to work from. I have them write all their traumas, and we start off by talking about the most least intensified trauma, and we process it, and we tell them, and I tell them, okay, tell me the facts first about this trauma, and tell me, okay, this, and this happened. Okay, how do you feel about it? Or how did you feel as you were telling me about it? And then we talk about it, and then I help them to figure out what core beliefs have been structured from that trauma, and then we work to basically disrupt and dispute those core beliefs, because core beliefs are like glasses, like if you have a bad pair, you're going to see things, blurry or a little fuzzy. But if you get a new pair of core beliefs or a new pair of glasses, you can see things clearer. Right? And I think that's kind of how,
EMDR. The eye movement is the hands or the wand, okay? Because we're using the eyes to move the eyes, okay? So we're desensitizing too, right? So the exposure, like we're let's not resist it, right? What we fear, we resist. So we're going all in, right? Now you just view yourself in the movie. And then we're going to reprocess that, right? We're going to change it up to the narrative, although the past is the past, but we're in the present now. So how can we reframe or reconstruct this movie? Gotcha. So that you understand, you're okay with it.
So tell me how important, because we're off camera, we were talking, and I was talking a little bit about values and how that's so important, and how values can basically help you to move past your traumas. Like, how have you seen people use their values to move past some of their traumas?
Okay, so we can say, a lot of us pride ourselves on strength. I'm strong. I can handle everything, right? So we can take that word, right? And then in our most vulnerable, or after we've experienced trauma, we don't feel strong anymore. Right? And then that strength has to come, that resiliency and that strength comes through when we're processing, and having that courage to, that strength and that courage to move through that experience.
Gotcha.
So that you can facilitate your healing, being present, and move to your future.
Gotcha. Because that's what's important, right? Like, we always say, like, you are bigger than your traumas, right? You are bigger than your traumas, because by recognizing that, it helps you to move forward, to continue when you have those dark days. Let's say you're triggered. Because even though you've done the work and processed it, you will at times have be triggered. Like, you will have a memory or a flashback.
That's how we're able to gauge how we're moving. How we're being treated, or the treatment, right?
Exactly.
And advancement.
Definitely. I know you mentioned something about shadow work, right? We spoke a little bit about that off camera. Can you explain what shadow work is?
Yes. Okay. So shadow work, then spiritual, means that you are always really looking at self and how taking accountability and responsibility for self in certain situations, right? So when we look at our traumas, if we're not dealing with them or addressing them, that's the shadow work. That's the other self that we don't want to address. So that's where the trauma comes in and the shadow work and trauma aligns.
Yeah. Okay, got you. I love that. So I want to try to like bring in a little bit more of like just your personal experiences working, because I think it helps people to see that people have made this journey.
Yes, right? People have healed.
Exactly.
Yes.
So obviously, everything is confidential, but can you just give us some examples of how you've seen someone go from just where they were when they first saw you to, them being, way down the line in their journey of healing?
Oh, okay. So I have one client that came in with lots of trauma, complex trauma, right? And then behind that, after we started moving through the trauma, there's all these other feelings, right? So we addressed those, and now she's in a place where I'm okay with telling my story to people. I'm okay. I want to tell this story so people understand they're not alone. Because for so long, I felt that I was alone.
Yeah. It's now just like my shirt says, right? Like being vulnerable is a sign of strength. Yes. And by doing that, by telling your story, you're encouraging those people who are a little bit afraid, right, to step out and talk about what it was they experienced.
And and that's the thing about the more we talk about it too, it's a way to desensitize. And also to do the work, our shadow work.
Exactly.
Yeah.
Conswello, how much do you love your job? Because I can tell you light up when you talk about this stuff.
Yeah, I didn't. I fought it for so long.
What?
Yeah, I did.
Yeah.
Because of who I am, right? I'm a spiritual person. So in that, and I believe in healing and facilitating healing, not necessarily along the same lines as what we've been taught all the time. So that conflict in there, and how I would be received by the populace,
Gotcha.
But I love it. I'm here and I love it.
Man, I can tell. And again, like when people are following their values, right? Like it truly does fill their cup, And I was gonna make a podcast later, and actually I won't go too much into detail about it, but I think at times people are so focused on a goal that once they reach their goal, that it's like, well, now what? Like they're not following their values, So once you're able to follow your values, it really does help, to get you to move forward in life.
Yes.
Right. So if you don't have those values, it can be, things can look a little bleak, and maybe bleak is too stretch of a word, but it gives you an end point, and once you reach that end point, you're kind of lost, like you don't know where to go next.
But I see a lot of people changing their values too now. Because they realize, this was taught to me. It wasn't something that I really naturally gravitate to. So and that was, and I'm bringing that up because I can relate that's for me. You know what I mean? Because I valued something else that I was taught. But then over time, I've now learned, you know what? No, this adds more value for me. And so I value. And that's from becoming a spiritual person, a spiritual being,
Gotcha.
And going through transformation and doing the work.
Yeah,
Still doing the work.
Gotcha. Okay. So I know I've asked you a lot of questions about sexual trauma, and you did an amazing job answering them all. But I want to kind of give you a chance just to say just anything about sexual trauma that you think that the people would like to hear.
Okay, for individuals that are in a space of shame and guilt and just dealing with the act of sexual trauma and what happened, I want to say to you that you are, it's not your fault, and that you are loved and supported, and there are people here around you that you probably don't know of that are there to support you. Also, if you're facilitating your healing, I say, hey, it's nothing wrong with getting some therapy in the meantime, in between time, because we are trained in certain ways that can help you to facilitate your healing in different ways. So yeah.
Definitely. Okay. Appreciate that. So again, we're pretty soon we're about to wrap up, but I know that we talked about also a book that we feel that a lot of people should read off. We talked about it off camera, and that one book is The Body Keeps the Score.
Yes.
And this book is really all about trauma and how the body not only recognizes it, but it holds on to it, right? And I kind of wanted to give everyone a chance to kind of like hear a little bit about that book, what it's all about, so on and so forth. So if you don't mind, The Body Keeps the Score.
Yeah, I really like the book because what's his name, Bessel, describes how he, even as a clinician practitioner, had trauma and then also was able to see the different ways that it manifested, and he experienced it, but then also in his healing, using EMDR, using yoga to help facilitate not only the mind, right, in processing the trauma, but then actually using yoga for the body to help remove the trauma, move it through the body. Yeah. So I love that, and that's what I want to do too for my dissertation. So
nice. Okay.
Yeah, great book, and I think people may think it may be so the terminology more medical, and I found it to be a little bit more easier reading than I thought it would be. So I encourage everybody just to get a background in how the body trauma sets in the body. I think it's very important.
Definitely. For anyone that's listening, I definitely want you guys to like, comment, subscribe to this video. There's a lot of information that's being given. As I mentioned, I will continue to bring on therapists, but also just other people in the regular public to talk about mental health. So definitely I want you guys to follow, so that way you can get all the new podcasts and episodes. So go ahead.
Yeah, I have one more book. This is Black Girls Heal.
Oh, nice.
And I use it. Yes, it's a coloring book.
Okay.
But I want to show how it has the different bondage breaker and has different questions. So this is something that you can work through, even if you're at home and then you just want to work through some things and not comfortable. I love this book. I use it all the time.
Gotcha.
You can use it for men too. So even though it says Black Girls Heal too, and it's written by a therapist.
Okay.
Yeah, Sheena Tubbs.
Nice.
Yeah.
Okay. Well, Conswello, I appreciate it. As a matter of fact, I have a book that I'm gonna show. Actually, I have The Body Keeps the Score in my bag.
Yeah.
So I'm gonna show them guys that book cover.
Yeah.
But while I do that, can you tell everybody where they can find you, the things that you have coming up, so on and so forth, so that way they can follow you and keep up with the great work that you're doing?
Okay. Yes. I have my website is Goddess. You can do goddesshealthandwellness.com. It will come up. Also, I will be presenting for the Association of Black Psychologists on June 5th. Excuse me. It's a CE. It's a continuing education, but then it's also open admission, $10 if anyone wants to come and learn more about reparative justice and social advocacy and mental health.
Definitely.
So yeah,
definitely. No,
doing
awesome,
that.
Awesome. For anyone that wanted the book, here it is. The Body Keeps the Score. You definitely want to check it out. I'm about 3/4 of the way done, and I can tell you one of the last few chapters actually really talks about healing, and it talks a lot about yoga, mindfulness, using things like kickboxing, or how even going to a massage therapist can help you to get more in tune with your body.
Yeah.
Right. So it's a lot of great gems in this book. You definitely don't want to miss it. So guys, thank you. I hope this episode was everything that you thought it would be and more. For everyone that came this far, I hope that you got something really great from this episode. I know sometimes people like to tune out a little early, but I promise every time I bring you guys on, or I bring someone on, there's going to be some type of resource or a book or something like that you can take away. So again, my name is Coach Wells. Also, they call me the Players Coach. You can check me out on theplayerscoach.net. The name of this episode, or the show, is The Podcast. And The is actually an acronym that stands for Therapy Helps Everyone. And today, Conswello, thank you for helping us show how therapy can help people that have been sexually traumatized.
Yes. My pleasure, and thank you for having me, Coach Wells.
No problem. All right, see you later.